The foot is one of the most common sites for painful disorders, and problems often develop because of poorly fitting shoes. Shoes that are too tight or shaped unnaturally can distort normal anatomy, cause deformity, and lead to pain. In addition to mechanical issues, dermatologic problems like fungal infections and plantar warts are also common. Certain systemic diseases contribute as well. Patients with diabetes may develop corns, peripheral neuropathies, and ulcers at pressure points of the foot because of diminished sensation. Patients with peripheral vascular disease and arteriosclerosis often complain of burning and itching feet, and the scratching can result in skin breakdown. Rheumatoid arthritis can cause deformities of the foot, and obesity can place so much stress on the feet that problems such as adult-onset flat foot and plantar fasciitis develop. Foot strain is generally managed with rest, elevation, physiotherapy, supportive taping, and orthotic devices. Patients need to inspect the foot and the skin under pads or orthotics daily for pressure spots or breakdown. If a shoe is modified with a cutout window to relieve pressure over a bony deformity, the skin in that area must also be checked daily. Active foot exercises are helpful because they improve circulation and strengthen the foot muscles. The best exercise is simple walking, as long as the shoes fit properly. When surgery of the hand or foot is needed, the education of the patient and caregiver becomes essential. The patient should be able to identify the name of the procedure performed, understand any permanent changes in anatomy or function, and recognize how this will impact daily activities, roles, relationships, and even aspects of spirituality. Education also includes making necessary modifications to the home environment, using adaptive equipment, and following the prescribed post-operative regimen. That regimen includes immobilization when ordered, avoiding heavy lifting or driving, preventing wound infection by keeping dressings clean and dry, assessing neurovascular status, controlling swelling by elevating the extremity and applying ice intermittently if prescribed, and observing weight-bearing limits. Patients should also learn to use assistive devices safely, maintain a healthy diet to promote healing, know the names and side effects of prescribed medications, and recognize signs of infection or complications. They need to know how to reach their provider, keep follow-up appointments, and adopt health promotion strategies such as weight reduction, smoking cessation, and stress management. A callus is a thickened area of skin that develops from persistent pressure or friction. Poor foot mechanics usually come first, and the callus develops later. Treatment focuses on correcting the underlying problem. Painful calluses should be treated by a podiatrist. Sometimes keratolytic ointments, felt padding, or plastic heel cups are used, and orthotic devices may help remove pressure from bony prominences. A corn is another common condition. It is an area of hyperkeratosis, or overgrowth of skin, caused by internal pressure from a prominent bone or external pressure from tight shoes. The fifth toe is most often involved. Treatment by a podiatrist might include soaking, scraping off the thickened skin, applying protective pads, or in some cases, surgically modifying the underlying bone. Early treatment is particularly important in patients with diabetes. Soft corns are located between the toes, where moisture keeps them pliable. These are managed by drying the spaces between the toes, placing gauze or lamb's wool between them, and choosing shoes with a wider toe box. Hammer toe is a flexion deformity of the interphalangeal joint that may affect several toes. It often develops when tight shoes or socks push the toes out of alignment. Corns form on top of the toes and calluses under the ball of the foot. Treatment includes wearing properly shaped shoes, manipulative exercises, and protective pads. In some cases, surgical correction through osteotomy is needed. Ingrown toenails, known as onychocryptosis, occur when the edge of the nail grows into the surrounding skin. This can lead to infection and granulation tissue. The most common causes include improper nail trimming, tight shoes, toe deformities, or trauma. Prevention involves trimming nails straight across and filing the edges to match the contour of the toe. Management includes washing the foot twice daily, soaking for comfort, relieving pressure, and, if infections recur, surgical removal of the nail by a provider. Clawfoot, or pes cavus, is an abnormally high arch with the forefoot pointing downward. It is commonly caused by neurologic or muscular disorders, such as Charcot-Marie-Tooth disease or diabetes. Patients may develop painful calluses on the top and bottom of the foot. Treatment includes exercises, orthotic devices, and sometimes surgical fusion to reshape the foot. Bunions, or hallux valgus, are deformities where the great toe deviates laterally. A bursa can form and become inflamed, causing redness, swelling, and pain. Causes include heredity, poorly fitting shoes, osteoarthritis, and natural changes that occur with aging. Treatment ranges from proper footwear and corticosteroid injections to surgical correction when severe. Morton neuroma is a swelling of the third branch of the median plantar nerve, leading to throbbing and burning pain in the forefoot. Conservative management includes shoe inserts and corticosteroid injections. If these fail, surgical excision is performed, though it results in permanent loss of sensation and increases fall risk. Flatfoot, or pes planus, occurs when the longitudinal arch of the foot collapses. It may result from congenital issues, excessive weight, fatigue, or arthritis. Symptoms include pain, burning, swelling, and fatigue. Exercises and foot orthoses are helpful for support. Plantar fasciitis is an inflammation of the fascia that supports the foot. Patients typically notice sharp heel pain with the first steps in the morning. Pain improves with stretching. Management includes supportive footwear, stretching, orthotics, and corticosteroid injections. Chronic cases can lead to fascial tears and heel spurs. Foot surgery is performed for deformities, neuromas, and other painful conditions. It is usually done on an outpatient basis. Before surgery, the nurse evaluates gait, balance, and neurovascular status and assesses the home environment for safety. After surgery, frequent neurovascular checks of the toes are essential to monitor circulation and nerve function. Patients are taught to elevate the foot, use ice packs if prescribed, and take analgesics as ordered. Bulky dressings, casts, or protective boots will be applied, and weight-bearing limits are set by the surgeon. Crutches or walkers may be needed. The nurse ensures safe use of these devices before discharge and discusses strategies for safe mobility at home. Post-operative complications can include blood clots, limited range of motion, infection, or recurrence of deformity. If pins are used, they require careful cleaning to prevent infection. Patients are taught to keep wounds clean and dry and to cover dressings during bathing. Education for both patients and families is vital for preventing complications and promoting full recovery.